Everyone at OpenLine talking about Alzheimer's. The Alzheimer's Walk is coming up this weekend, but tonight on OpenLine, we're really just kind of taking a closer look at this disease that impacts so many people, learning as much as we can about it. Happy to have with us people who can help us. Dawne Bunn is Executive Director of Tennessee's Alzheimer's Association, and Melissa Cuthbertson, you're chair of the walk that's coming up, but you have a personal story that you've been willing to share, and we appreciate that. All right, research. Alzheimer's Association, huge association nationally, locally. What about the research that you all are helping to fund that you're seeing now?
Sure. So we are the largest nonprofit funder of Alzheimer's research, and we also fund research from the association. So we provide grants back here in Tennessee. We do have some grants at Vanderbilt Alzheimer's and Memory Care Center. There are researchers at UT Knoxville that have received grants. Meharry Medical College, I saw recently, a researcher there received a grant from us. But currently we're funding about $310 million in projects, about 950 projects in about 48 countries. So that's exciting in itself, but we are also advocating at the federal level to ensure the funding from the U.S. government to the NIH for research. So in the last 10 years, efforts from our advocates like Melissa, who are out there telling their stories, talking to their legislators, we have been able to increase the funding through the U.S. government from $504 million to $3.5 billion. So that is an incredible progression, but unfortunately the disease is currently costing the U.S. $321 billion, which we do anticipate to be $1 trillion very shortly. So it's going to triple in the next 10, 20 years. And we are all, I think, obligated as U.S. citizens to pay attention to what's happening with this disease and to get involved. So that's why we're so excited about the Nashville Walk to End Alzheimer's. It is the largest awareness building campaign, but also the largest fundraiser for Alzheimer's in the country. So.
How encouraged are you, again, your dad passed away in 2017. How encouraged are you by all the research that has been done since then? And do you think it would have changed anything for him, or maybe not yet, but what about, how encouraged are you by all the research?
I'm very encouraged. I think that's what we have to lean on right now, is the scientists and the research, and that's where we're looking for those answers. So I'd have to.
You're encouraged, sure.
Yeah.
Caregivers. We talked a little bit about caregivers. There's the sandwich generation. And I didn't know a ton about that, but explain what that means. And you're in that, right? But explain what that means.
Right. So sandwich generation is if you have parents that you're caring for, and you're also have children that you're caring for. So I fell into that category, and that's where caregiver burnout can really increase when you're doing both. So. Yes, as far as being that part of the sandwich generation, I have 3 daughters, and I had one in high school, about to graduate high school, and my dad was diagnosed, and the other 2 were between middle school and elementary. And then I had my mom and dad that I was caring for, so juggling both of them and then working full-time on top of that, and then trying to care for yourself, it can be pretty challenging. So,
yeah. What about that?
Well, we talked about the 6 million Americans living with Alzheimer's, but there are 11 million caregivers. So unfortunately, we also need to make sure that we're caring for the caregivers and taking care of their health. And here in Tennessee, we have 361,000 caregivers. And at the Alzheimer's Association, we provide education programs, support groups. We have the 24/7 helpline that we mentioned. We do a caregiver conference. That caregiver conference here in Nashville is happening on November 9th and 10th. And we're excited to invite really anybody to join us for that conference. There's so many factors that play. It's just not the day-to-day care. I mean, there are financial factors, legal factors.
Yes.
And so we want to make sure that we are a resource to families who need us while they're on this journey. And those needs are large, and so often we hear families receive a diagnosis from their physician. We talked about neurologists or neuropsychologists that provide these diagnoses, and there are some incredible physicians out there. But all too often, a caregiver will receive, or someone living with the disease will receive that diagnosis along with their caregiver, and unfortunately, those providers are not providing a care plan. Can you imagine being diagnosed with cancer and not walking out of the doctor's office knowing exactly what your treatment would look like over the next 6 months? What is happening too often is that these families are receiving this diagnosis and then they walk away with no care plan, but they get an appointment in 6 months. So that's where we come in, and we can kind of close that gap at the association and provide some additional support. But we also have our health systems initiative, and that initiative is working with large health systems, but also providers, to ensure that they have the resources and the tools that they need to both assess, diagnose, and then provide that care plan. But we need to incentivize these physicians to do that care planning. So we also are working at the federal level with CMS, or we're working with payers to offer incentives to providers to give the diagnosis, but then also do the care plan.
And the care plan, I think I know what you mean, but what would that look like? What drugs you're going to take? What do you mean by a care plan?
Exactly what Melissa talked about with her journey. There's so many questions that come into play, so many scenarios. Your family member is showing new symptoms, or they get injured, or the medication isn't helping. And when I want to clarify, when I say medication, most of the medications prescribed these days just address some symptoms, not the underlying causes. So they may help a little bit with anxiety or some behavioral challenges. There's just so many different things that come into play, and a family needs their physician to help guide them on that journey. And the practices that do it so well offer that social worker that sticks with the family and is there to answer questions, or the physicians are checking in more often with their loved one, or offering clinical trial. There are so many clinical trials available in this field. So I do want to mention Trial Match as well. It's our database of trials that are available, and anybody can go on and learn more about a trial that may potentially help their loved one. And there's also trials available for healthy individuals that may have a family member and their family that had the disease, and they just want to be a part of a trial or be a part of supporting innovation in the future. Absolutely.
You talked about, Melissa, when you knew, and it was when you held up 2 things of pasta and your dad, and it was more speech. Right. You recognized that there was a problem.
Right.
When did you get an official diagnosis from a doctor, and how did that happen?
That's a great question.
Well, actually, I went back when they were still in Oklahoma, and I started, when I was doing my own research, I looked for a neuropsychiatrist. So I flew out to Oklahoma from Tennessee, got into a neuropsychologist in Oklahoma City, got the results, read over the results, and I truly didn't know what I was reading. They didn't go over them with me. They just said, here you go, here they are. And I thought, okay, well, then what's next? And so it literally just became a step process. That was the start, and now if I looked at it, I would understand a little bit more of what tests that they did on him, just to see how he answered the questions or didn't answer the questions. But then it was just getting him to the physician and getting to a neurologist. I think was the most important step for us, because that's really where most of our answers came in, was from them. They're more trained, obviously, with the disease because it's a neurodegenerative disease.
And what is the test? Is it an MRI, or is it you answer questions? So what if you take your dad and you're worried about this, what do they do?
Yeah, they do a cognitive assessment test, and I'm trying to remember the name of it. That I'm trying to remember exactly what it is, but they do an assessment and it tells where they rate on it. One of the tests I remember them doing is they wanted to check his balance, and so he took like a tool and ran it up the bottom of his foot to see if he had any reflex at all, and he did have a pretty good reflex, but that was one. They asked him, like, what time is it in the day? Is it morning, noon, or night? And those were questions that the neurologist would also ask. Or he would say, I'm going to give you 3 words. Can you repeat them back to me backwards?
Okay.
So it's just trying to get them to think and see how you answer the questions. Those were beginning tests.
And yeah, what do you recommend for families? You know, you're at a family gathering this Thanksgiving, and you think, okay, I think mom or dad has a problem. What's the next step?
It's going to be different for every family, but if a family can open the conversation, obviously that's going to be the first start. And sometimes you need some support in how to do that. I mean, that's another place where our helpline can come into play, or our program team here in Tennessee can help answer some of those questions or talk through what that could look like with families. And so, you know, but a lot of people do see those warning signs around the holidays. And so, you know, the call volume for us really increases around the holidays. But, you know, as Melissa was sharing, mostly it's a clinical diagnosis, but the Alzheimer's Association has been involved in almost every innovation in this disease, including, you know, we funded the initial testing on PET scans. So there actually is now a PET scan that can definitively diagnose Alzheimer's before death. It used to only be able to definitively be diagnosed at autopsy. So that's a development, but unfortunately it's not covered by insurance, and it's not currently covered by Medicare. So again, that's another role the Alzheimer's Association plays, is to advocate with the Centers for Medicare to cover such tests and to work with payers to cover such tests. Again, can you imagine being diagnosed with cancer and know you need a PET scan, but it's not covered by insurance? So there are tests. They're, you know, invasive because there is a spinal tap as well, or they're expensive. So oftentimes it's a clinical diagnosis that is oftentimes pretty accurate. Over time, it may the signs may become a little bit more clear from the original assessment, but it's a longer process. Some of the tests that Melissa described last up to 2 hours, and so for somebody who is sort of showing those early signs, and so it can be hard, but it's worth it, because I think when you have the diagnosis as a family, you can prepare for what's to come.
Right.
Alzheimer's, it runs in my family. And so what are there tests that would indicate the likelihood I might get it? Now, obviously it runs in your family. Have you done tests? And what about how much does heredity play into that, and, you know, that whole issue? And I'll start with you. You know, what did you do after you saw your dad?
I tossed the idea around. I understood you could get tested for the gene, and they call it the APOE gene. And there are 4 different alleles, and it's the 3rd allele is the one. If you're diagnosed with that, or you're tested and you're test positive for that they say that's the gene for Alzheimer's. I since then have been tested, and I don't have the gene, which I'm grateful for.
Yeah.
So, yeah, that's...
But you could not have the gene and still get Alzheimer's.
You could not have the gene and still get it, exactly.
Right.
So, as I can't stress enough that to try to take preventative measures, the sooner the better. But and it's not to run in fear, but just we need to do that for ourselves anyway.
Right.
Just for our overall health.
And heart health is brain health. So I think Melissa talked about it earlier, managing your blood pressure, eating properly, you know, exercising regularly, socializing regularly, challenging your mind. Those are the things, you know, and there are a lot of studies out there about preventative and risk reduction. And I was able to attend the Alzheimer's Association International Conference this summer in San Diego. It's the largest convening of researchers in the world. There were over 10,000 people participating, 5,000 of them live in San Diego. And we heard from one researcher who showed very positive results with just simply stretching for 30 minutes a day. So it's not as if we're asking people to run out and run a marathon or jog or even, walking, but stretch, movement, and a lot of that can be done. Even as our loved ones age, they can do some simple movement to continue to slow the progression, and ultimately that's what the families want, to ensure that folks, their progression doesn't move too quickly.
That is so important. Okay, I'm so glad you talked about that. All right, we'll take a break, come back, continue our discussion right after this.